Your facility in New
Thank you.
Hampshire.
Thank
Where
you.
exactly is it?
We are in Nashua, pretty much like 3 minutes over the border off Route 3 North, exit 5E. We're at 157 Main Dunstable Road, and the clinic is it's INDRA. INDRA Biomagnetism is the name of the practice, and you could find all of my information, our information, online at weareindra.com. So I guess we'll just start off a little bit talking about my background and history and how I got here. I started off as an occupational therapist many moons ago, graduated from Quinnipiac College at the time, and studied occupational therapy, really specialized at first in brain trauma and chronic pain. I worked at Spalding Rehab in Boston for a while, then transitioned to acute rehabilitation in Nashua, New Hampshire at St. Joe's Hospital. So I got to see a wide range of patients. And the best exposure was that I was able to work with professionals, everything from nursing to speech to just all the different testing that was done. So you're immersed quickly into patient care. And then pretty much transitioned into pediatrics. That was my love. So I had my own pediatric business, did after-school programs, advocated for little ones, specialized in autistic and a lot of heavy special needs. And then it started where I was having my own children. And I decided, I'm going to leave the pediatric side of it to my kids and be with them, and then transitioned more to hospice. So I did home care and hospice for about 14 years and loved it, absolutely loved it. And then I found that the stress and burnout was coming to me because there was a break in our system. Our system was broken when it came to insurance. And I loved the patient care, and I couldn't stand the limitations that insurance put on care. So I really have always been interested in the holistic world of medicine. So I learned a beautiful science called Ayurveda, and that is the root of the wisdom of longevity and learning how to live your best life as long as possible, feeling as good as possible. So I still immerse a lot of that in my work now, but I remember clearly in 2015, I was at a crossroads of wanting to add more clinical experience to my practice because I missed that hands-on piece. So kind of put it out to the universe, and we'll talk more about it today in the world of physics and other dimensions. And I'm like, there's got to be something that I could fulfill myself with. And 4 people in 1 week told me about biomagnetism. And that was the beginning of this journey 10 years ago, and took a training in a certain protocol for biomagnetism that focuses on Lyme disease. And that's where my program, my life in biomagnetism took off and has grown since. So that's where it all started. And I have implemented a lot of the Lyme protocol on a daily basis, but at the same time, I have done a little bit of other trainings, and now I've implemented my own works, because what I realized is that the missing piece, and we'll get into biomagnetism some more, is no one was talking about heavy emotions. No one was talking about past traumas. There wasn't a lot of talk on the nervous system and how we are such reactive beings. I know Dr. Joe Dispenza, who's one of my favorite mentors, says that about 70 to 95% of patients that walk into a clinic or a medical facility are there for stress, physically stress-induced and emotionally induced symptoms. And they come out of the body in disease processes. So we've got a real issue. So that's where the root of my protocol took off.
And did you start as a private practice?
I started with biomagnetism as a private practice, just my own little space. I was in a wellness center that we had created, and it picked up pretty quickly. I would say within 4 months, word of mouth traveled, and it's only been word of mouth, quite frankly, which has been beautiful. And you start to see one person, then wait, my brother, and what about my husband? And they've got this symptom. So it's grown from there. But yes, private practice is where I have been. and then worked with a lot of colleagues on it too to help grow a nice foundation for biomagnetism in the southern New Hampshire area. Let's talk a little bit about the body itself. And if I usually at work have a nice big cup, empty cup here, but I will show you. So basically, we are vessels. We are vessels as creatures, as humans. And when we're born, we even have a little bit of things that get dumped into us because of our parents. So whether mom had some old strep infections or some old trauma herself or dad did, and then we start to accumulate. So maybe at age 4, you fall off your bike and you're learning how to use training wheels and you skin your knee. People don't talk a lot about, there's an emotional trauma that comes that's just as substantial, if not more, than a physical trauma. And then there's a couple bouts of strep throat. And then maybe the person got vaccines and the body rejected it a tiny bit. And then as it continues to fill, there maybe a grandparent passes away. And then they get mono entering college because there's been a high Epstein-Barr virus load, which we'll talk more about. And then we spill over. And when that cup spills over is when usually we see a breaking point where we then see this unusual rash that the body has, or these horrible digestive issues, or maybe the person finally gets diagnosed with Lyme disease, but the bite didn't happen when the cup spilled over. It happened earlier on, and the body did its best, as it should, because the body is brilliant. That is our tagline. And that immune system kicks in constantly until it can't. And now you have an infection load that's high, an emotional load that's high, a dysregulated nervous system that's high, hormones that are imbalanced, and this immune system is just underwater. So this imbalance is what creates dis-ease or symptoms that manifest into who knows what. And that's where I have a tough time at times with diagnosis or naming a certain condition. We've had to do that in Western medicine. And I can sometimes bash it a bit because I'm an occupational therapist, so I've lived that life, is a lot of times a diagnosis is put on in order to give a medication. And we do have diagnoses like seasonal affect disorder and irritable bowel syndrome and things like this that are a little bit more vague. And there's a medication that someone could be put on to help that. But we are root cause. So the whole idea of this cup analogy even is to get down to empty that cup, like work on those infections, work on those traumas, put voice to them, start to guide the body to clear it itself. That's what we do. And then that's where we start to see symptoms dissipate, where people have been to so many practitioners and medical facilities. And there's some movement that happens.
There's 6 stages of disease in Ayurveda. That's the cool one I thought of when you were talking.
It's called samprapti in Ayurveda. And in Eastern medicine, which is Ayurveda, they look at things in a much more subtle way. Okay, so let's first start with Western. And again, here, let's use the States here. Usually it takes us getting sick. Like, I am sick. I have a sore throat. I broke out in this rash. That's considered the first stage of disease. And then you have to access help from there. Where in Ayurveda, it's called samprapti. That's stage 3 of the disease process is when it actually manifests. Stage 1 is something's just not right? I'm a little overtired. I'm a little anxious, or maybe you don't even have anything to label it. Something just doesn't feel right. And that's considered the first stage of disease where we need to pay attention. So in turn, when that early intervention is done of really looking into that emotional root or the physical root of maybe taking a rest, maybe hydrating the body, maybe simple going for walks or resting, and those will curb that disease process in a way that we don't get to that level 3 where we spill over. So it's a much more nurturing, self-reflective sense of care that's done in other parts of the world. And we're a little behind here in at least in North America, for sure. My roots are in Ayurveda, so Vedic psychology is something that I've loved and studied. And basically, the root of it is this birth to 7, 8, 9-ish years old, we don't have intelligence. So anything we're exposed to is truth. And the body and mind don't know any different. So whatever, a lot of us, most every human has been through some traumatic experience, either physical, emotional, and it kind of hides in that subconscious, which is what we access in biomagnetism, and kind of gets stuck like a baby root. And then as we grow and we gain intelligence, we get triggered as we're older. And we might have some big visceral reaction to something that's come up. And we go, wow, am I overreacting? But this feels like a big issue. And we could always trace it back to childhood where something just did not get resolved. So by the time the person is 50 and having this really big external reaction, that like root has grown into this knotty big mess. So we do a lot of work at digging into those old memories. And it's subtle. This isn't talk therapy. This isn't having to dig deep in a way. It's just when we're able to access that subconscious, we're able to unlock a lot of old traumas that lead to disease.
You'd never think something like abandonment in the grocery store. You give that example.
Yeah. It's the emotion of abandonment will come up, and we'll talk more about our emotional vibration scale, but someone could really have a visceral reaction to a breakup later in life that almost feels irrational. And it goes back to maybe a child got lost in a grocery store and felt abandoned when they were young, and that feeling of being left was never quite dealt with. So it shows up in other areas of life as an older adult, and we're here to help unravel some of that stuff. Biomagnetism, in my opinion, we'll start off with this, is probably one of the coolest modalities that I've ever encountered. The interesting thing about this is, unlike acupuncture and some of these Ayurveda, these old sciences that are from 5,000 years ago, 4,000 years ago, biomagnetism was just created in the late 80s, 1988, which is mind-boggling. And that's probably why also with this newer science, it's starting to spread, but it's still a baby. And basically it started to give you a little history, as I said, thousands of years ago, even Cleopatra used a ferrite rock on her forehead, which ferrite rocks have electromagnetic fields, are magnets that pull from the earth, a biomagnetic field. Would put it on her forehead. You could see she'd put it in the jewel to help with headaches. And there you could look at hieroglyphics in caves from years ago that showed about the use of magnets, rocks that were used to heal ailments, and the history goes on and on. It's quite fascinating. So a lot of times you'll come into our clinic space and it has this like beautiful vibe and this holistic, almost like a bougie healing vibe to it, when it's so rooted in science, and people get to know like, wow, this is legit when they come in, because we give a lot of history when we teach our clients. So in 1988, Dr. Breuingmeyer was running this, he's a physicist, was running this conference and this training. And because he had realized that when he sent astronauts to space through NASA, and they were at the space station for a period of time, their electromagnetic field, being away from gravity, was eliminated. So when they came back to Earth, that right leg was a couple centimeters to a couple inches longer than the left, shorter than the left leg. And it was pretty much in every single astronaut. And they couldn't quite figure out what was going on. So with research and having their background in science, they realized, well, if we restore the electromagnetic field by putting a pretty high-powered Gauss magnet, which we'll talk more about, on the body, the leg went back to normal length. So almost like that leg length discrepancy showed an imbalance in the body. And when there's an imbalance in the body, we know that's the beginning of the disease process. So Dr. Goyes, a brilliant man, again, in the sciences, went to a training with Dr. Breuingmeyer and said, okay, what if we put magnets in polarity? So we use a North Pole and a South Pole magnet on the body in different places. The first pair was actually for HIV virus. So to help the body work on the symptoms. Remember, the body is the one that's doing the job at clearing symptoms of infection. And they found that putting a North Pole magnet on that thymus, which is your immune center, and then the light magnet in ours, which is a South Pole, on the rectum, tailbone area, was the perfect resonance to be able to vibrate with the virus of HIV, to be able to allow the body to break it down. So we're creating, actually, with two magnets in polarity, a pH neutral. And when there's a pH neutral, infection and pathogen can't survive. So it becomes this weakness of that pathogen where the body can be like, okay, now I'm not underwater anymore. I can start to rise up and do the job I'm supposed to do. So people will come in thinking we're the masters and the magnets are doing all the work. We're really good reads of the body. But in turn, we're just utilizing this beautiful tool of kinesiology, which is muscle testing the body to find out what's going on, placing magnets appropriately on the body in patterns where infection or emotions like to hide or imbalances happen, and homeostasis occurs. And when homeostasis or balance of the body occurs, that's when health takes over. And that's where with our clients, we start to see this uptick of health. And before you know it, they're like, I can't believe my symptoms are dissipating and my emotional state feels more balanced.
Does the infection go dormant, or does it kind of flush out?
From our experience, and I'm going to say there's theories on this. I'm going to speak from my experience with all of this, right? Because a lot of this could also be controversial. We see from our testing, our testing through the body, that things don't really go to a dormant state. The body is able to almost eradicate it on its own. The symptoms of these disease processes, everything comes through our door, from MS to severe seizure disorders to even just some reflux that could debilitate someone that has an infectious root. And we find that when the symptom dissipates, we do find that the body shows no more sign of that infection, which is pretty cool. When we talk about NASA and that leg length, where all of a sudden that leg will shorten up a little bit, the reason we find in our practice that it's usually that right leg that will, almost like you touch a hot pan, will shrink up just very temporarily. People will get nervous, like, is it going to stay that way? It doesn't stay that way. It's very quick. When we do our muscle testing, which I'll explain, is because the heart has an electromagnetic field of strength on the left side of the body. So that electromagnetic rhythm stays really long and strong on the left side. Hence, the left leg stays longer and in its place. And the right one is a little bit more vulnerable. So that's how we see it. So the reason we tell people this story, we like to inform our consumers, our evaluations are quite in depth, is because when we do in-house, our private room that I end up doing when we're dealing with a little bit more complex autoimmune issues, a little heavy, more Lyme and vector-borne infections, or just some cases that are so heavy, people will fluctuate between the clinic, and I'll describe that in a bit, and the private room, because we want to address all of the needs of the patient, the client. So in the private room, people will lay on the table, get really comfy, legs up on a bolster. And I will utilize either their sneakers, if they're really tight, good heel length, or we'll put on these little shoes that are, some people think they're magnetic or like magic shoes. They're definitely not. They just allow to see the heel, that leg length, because that's what we're looking for. So when I'm lifting up those legs, remember, we're looking for imbalance, because that's how it started with NASA. And this all stems from, and bear with me because this can sound a little woo-woo, even though it's seriously rooted in science. Everything that's ever happened to you from in utero until now is housed in a memory bank in our subconscious mind, right? So we do it like an iceberg, where right now we're talking, even when I talk with a client, we're talking about history and blood work and certain testings that have been done. That's the top of that iceberg. The bottom of the iceberg is what we're accessing through kinesiology. And it's a beautiful science, hence science, because it is rooted in physics. You'll even see the guys who are looking for well water. They even do it now. We had a well dug in our yard. And with all the science and technology that's out there, they still utilize L rods, which are just basic metal rods, or a pendulum, just like this that you'll see. And they will go over a surface area of a yard and look able to, with certain questions in their mind, dig for the most appropriate, best depth and best rate of water return with about 98% accuracy. And that goes back thousands of years. I teach a pendulum course on that and how to dowse. It's called dowsing. So basically, when we're lifting up these feet, we are utilizing this dowsing or kinesiology technique. And we'll go through many, many, many different strains of infection, imbalances, whether it be hormone or nervous system, heavy metals, and we'll look, and all of a sudden, when you lift those legs, and that you'll feel that, right? Like, and so will the client. They'll say, "What was that?" And I'll say, "It was XYZ that we're looking at." And then we make a master list. And once we find that master list, we ask the body, what is in your best interest to work on today? And we do like an onion, an unlayering that happens till we get to the root or get to the end of our list, depending. So it is so unique, yet so very effective. And what I tell people too, they could come in speaking another language and not be able to tell us anything, any of my clinicians in the clinic or myself, what's going on. Because I think with Western medicine, we have this urgency to fill it all in, like make sure you tell the doctor everything, make sure, and if you forget something, could that be, the missing piece that they left out? It's wonderful to have intake and history because we get to know the person on a personal level. But at the end of the day, we shut it all off. We sit at their feet or in our clinic style in these beautiful chairs with our pendulum that does the same exact type of read, and we shut it all off and we just read what the body says. And it blows our minds sometimes because as a medical person, I might have my idea of where that rash came from or where their eye pain is coming from. And it blows me away because the root was something completely different. It's like a puzzle. I always tell them we're going on a scavenger hunt. So it gives them their power back too. A lot of times it just gives them their power of we're in this together. And a lot of people aren't afraid to hear what we find because they felt so bad for so many years anyways.
I think there's a big discrepancy with
And it's interesting too, because when people are in practice in a session with me and they have their little ones, the little ones always go for the pendulums because they're so new on this earth and it actually resonates with them. And they're the quickest ones to be able to muscle test, which is, we call it muscle testing, dowsing, kinesiology. It's all pretty much the same. And they're so good at picking it up and learning how to do it, which is quite amazing. And there is a litigating attorney actually in our area who utilizes a pendulum under the desk in trial and is able to tell falsehoods and truths from that and does a very good job of winning cases. That is for sure. It's used for finding grave sites. It's found for finding oil and gold and you name it. It's a very old science, but we use it in such a brilliant new modality these days to help with health. And I will say, I don't bash modern medicine because we would be dead without it. Let's be very frank. Like you can't put a magnet on a bullet hole. We need modern medicine for so many conditions. The issue we've run into is we're treating chronic conditions with acute medications. That's the problem. So it has this Band-Aid technique and people are exhausted from telling the same story over and over without a lot of getting to the root of it. So they're chasing and then again, certain medications, which we do need, but a lot of them are overprescribed because we really don't know the root of what's going on. Those have side effects. So then now do you have symptoms based on side effects or do you have symptoms from the actual condition that's going on? So what I will say, and I'm so grateful for, is our biggest referral source right now are MDs, medical doctors, which has changed drastically over the years because this isn't looked at as more of like a woo-woo science. It's looked at and respected in the field, especially by a lot of our Lyme literate doctors, our neurologists, because we've worked with so many clients with unknown disease processes, endocrinology, MS with neurology. And we've had some really good success stories, which we'll go into, where I think it's also blown the minds of doctors, and a lot are receptive now, like maybe there's something missing here. And if we partner up together and utilize both our skill sets, one from an acute perspective to be able to help the body heal, and one from a root cause, you can't lose. So that has helped us out tremendously. It's nice to look where the referrals come from, because they're not just family members anymore. A lot of them were well respected in the medical community. Biomagnetism is, we're basically utilizing these high-powered magnets that are gentle on the body yet profound in certain patterns to isolate certain conditions or certain infections in the body. They stay on the body for about 15 minutes or so to restore that electromagnetic field. And when we're altering pH and bringing the body back to like a nice neutral place, all of a sudden this infection load that was so high is starting to go down, and that immune system's kicking in, and the body starts to restore to balance. So it's a root cause type of treatment, and we are able to use it on newborns. We have newborns that we work on with who are a couple days old. The moms call from the hospitals, all the way up to people who have pretty chronic conditions, or maybe sometimes they're in great health. We use it for prevention too, to prevent disease. And it's a beautiful modality to help the body restore balance. And when the body's in balance, health resumes.
And how long do the magnets stay on?
That's another really cool scientific fact, is that they stay on according to where we are in relation to the equator. So if we're in, I treat people remotely, which means that I am either doing Zoom or just a phone call to India, to Costa Rica, to Peru. And we're able, remember, there's no space and time, so we can utilize the pendulum. That's where this comes in really handy, because you're not checking the feet of someone thousands of miles away. And we're getting our yes and our no baseline. That could be anywhere in the world. Energy's energy. Yeah, and people they'll get baffled about how does this happen? And we say, well, if you subscribe to it, we don't really know how prayer works, but it has an effect. And then I tell people on the other end of it, like, we're not really sure exactly how Wi-Fi and telephones work, but you can call someone and reach someone somewhere else, or even through internet. Like, it's energy is energy. We all vibrate. We are vibrating beings, and then we just utilize these beautiful yet simple tools to help realign the body. And when it's realigned, health resumes. So it stays on. Yeah, I would say, to get back to the question around how long they stay on, people in India could be about 6, 7, 8 minutes, because they're closer to the equator. So the closer you are to the equator, the less time it takes to process the body getting back to that baseline. When we're talking about ions and alignment and hydrogen, there's a lot of heavy science in this, and you could learn more if you go to ymagnets.com. There's a whole beautiful description on how the ins and outs, the meat of how this works. But we also don't like to overwhelm our people too much, so we give it in small doses. But up in Maine, my clients, it's 20 plus 30 minutes that they stay on, because they're farther from the equator. So where we are in Nashua, New Hampshire, it's about 15 to 17 minutes to help that body reach that homeostasis and that alignment.
And once they reach homeostasis, do they feel better pretty instantly? Or, do they feel that?
And we don't tell the people too often of what to expect. And that is another, I think, a beautiful thing about it, is because every single person is so different. So we could have someone who right away on the table starts to feel, or in the chair in clinic will start to feel, wow, I feel like I'm buzzing a little bit, or I'm feeling more emotional, or I feel my feet are tingly. Most people feel nothing. And then we say, you know what? The body can go through something called a Herxheimer reaction, or a healing crisis, meaning as things leave the body, as these things start to break down that no longer serve either emotion or pathogen, the body can feel like, oh, wow, I was really tired today. Or maybe I felt a tiny bit fluish. But the majority of our clients, they start to feel a shift for the positive within a couple sessions. Like something has shifted here. Some are drastic, and we can go into some stories that will blow your mind. Another really cool thing is they come for visits. It's usually around the 2-week mark of what it takes for things to start to break down. And then that body strength to build back up to handle the next session. And about 24 to 48 hours before they come in, they'll start to experience a symptom of the next layer that's coming. Because the body is so brilliant. It says, okay, we know this layer's coming up, and this is the symptom that usually comes with it as we push it up to the surface. So people, instead of being fearful of the symptom of extreme fatigue or a little headache, or maybe their belly's a little upset, they welcome it because they go, look how smart, it's empowerment. Look how smart my body is that it's actually pushing this layer up. So my practitioner and I together, we're all about doing this together, can move that layer easier. Because the body truly is. I mean, if we look at it this way, when we cut ourselves, right? The other day I had a little burn on my hand. I reached into an oven and touched something. A doctor's not going to fix my burn. If it's stage 3 and we need medical intervention, thank God we have it. But a basic burn, the body is smart enough to heal it itself. That's the beauty of it. A bone breaks, a minor hairline fracture, we don't need intervention other than maybe a little stabilization, but the body heals from within. It wants to. The body wants to heal itself. We're just so inundated and have been overwhelmed that we've lost our way. So biomagnetism is a beautiful way to help light the path and help the body organize in a way that it can self-heal. And we do have skeptics, right? We have, usually the people come to us are so desperate because they feel so bad. I have one client, I'll never forget him. He was one of my first clients 10 years ago for biomagnetism. And he was panicked and scared because he had such chronic disease, and antibiotics were more of the so-called cure for it that he was allergic to. He was lost 40 pounds. He was mentally a mess and terrified, and also a huge non-believer in the holistic world. So out of fear, out of just desperation, he came in. And long story short, we worked together. And as time went on, he started to gain his weight back. The pain was gone without any intervention other than biomagnetism. And I remember him looking at me once on the table and saying, is this like placebo? Like, what's happening here? And I said, I'm not sure, other than I have intention to have you heal. You have intention. We're lining up the body properly and you're feeling better. So he understood the science piece of it, which is what he held on to. And within 4 months, he was back on the golf course and having a beer with his buddies and has had a much better state of mind, and his symptoms were gone. He still comes people come for maintenance, so they'll come every 3 months or so, sometimes every month, sometimes every 2 weeks, because they're not missing their visits because it helps them emotionally and physically. And to just do tune-ups. And that's where our clinic is beautiful too, because it does help with prevention. It's a little mind-blowing. People do leave. They're very grateful. And I think what it comes down to, too, our philosophy in our clinic, in INDRA overall, is care. Care is our number one motto. Because too often in our society and our medical model, it's so robotic and no connection with the client or the patient. And that's why our visits are substantial. We hold space. It's all about caring and listening, because the details really don't matter. I swear 75% of the healing is in the person being heard. And people, that might be bashing my own business of like, magnets are it. They're not. They're a huge piece of it, but holding space, acknowledging their feelings, having them be heard, giving them the time and space where you're not in a computer, but you're with them and acknowledging what they're going through, that is continuous throughout our entire program and with every single person that I'm lucky enough to have on my staff, because they are heart-centered. I would trust them with my family. That's the only reason I have them there, is because they give everything with their heart and soul. But I think if you talk to pretty much all of our clients, they would say that the heart-centered and the care focus is what makes them come back.
At the end of the day, everybody just wants to be heard.
That's it. That's all. We really are just, so many of us are just still small beings in these adult bodies that just want acknowledgement and care and love. And that's where healing happens. Because trauma, we from an Ayurvedic perspective, there's no physical manifestation of disease ever without an emotional root, ever. And I've gone head to head and discussed this with many practitioners and clients, and we always come to the resolution of, as an example, I'll have someone come in and say, my eyes started twitching so badly. Do I have ALS? Do I have MS? My feet are numb. And we'll go back and say, what happened when this started? Well, I have one person that said, well, my daughter was just getting married. We go, the body doesn't know the difference between physical and emotional stress. Stress is stress. And then we have someone else that said, my son was hospitalized and almost died. And then when he finally started to be stable, my symptoms came up. So that's when we look at, there is no physical manifestation of disease without an emotional root. And that's an important thing I believe all clinicians should ask is, what was going on at the time this started? We weave a pathway, and that's the importance and why we spend time with people. It's not to learn about their conditions, because we're going to take care of that in a different avenue with the muscle testing and kinesiology. I want to know you as a human. I want you to feel heard enough to be vulnerable to open up, because once people feel safe enough to open up, the healing starts to happen for all of us.
What is a success story that stands out to you right now?
There's a couple good ones, I would say. They're all truly, the coolest part is most cases are quite interesting and profound. And then there's just a couple where you're like, goodness, going into this, I don't know if we're going to be able to move the needle here. One of my very interesting ones, I actually had 2 children with kidney failure, basically, we can call it. And they had seen nephrology, they'd seen every specialist. And the first one, she was very little. And I remember scanning her. And when we say scan, it means that we're doing that kinesiology or muscle testing. That's when we're scanning the person. And I remember clearly her showing up for rare heavy metals. And I remember asking the mom, like, do you recall anything around rare heavy metals? And this child was on so many steroids. She was so sick. And this was actually in the throes of COVID. And her immune system was so compromised that I actually was doing the scanning in the back of their car. And she was masked and gloved. And this is when we really weren't sure what was going on. And keeping in the fresh air. And I was scanning her rare heavy metals. Couldn't think of it. Put on the magnet pairs for rare heavy metals, and her numbers shifted. She wasn't dumping the protein. Her body didn't require as much of the medication. And this went on, and there were other things, because sometimes people are like a soup. There's a lot of different things that add up to make this manifest into some sickness. And come to find out, the mom came to me one of the sessions and said, I think I figured it out. A paint store had exploded across the street from our house when I was pregnant with her. So we believe that whatever those toxins and metals went into the water, and then ended up causing the kidney distress. Kidneys filter everything in the body. And then another child came to us most recently, and he was medicated, high medication load, was spilling protein in his urine every day. It would consume the whole family. And she tells her story. And I remember, again, muscle testing him, and he had different interesting things. Some of it was he had some vaccine toxicity in the body, and then had some other infection load, and some of it was vector-borne, which is what we call in the tick-borne or Lyme world or mosquito world, and then had some strep in the body. So it was this perfect storm. And once we started taking layers off, he was not spilling protein anymore. And this child couldn't even, he walked a knife edge. He couldn't go swimming in a swimming pool because that would make him spill. He couldn't get stressed. He couldn't get a cold. He couldn't travel because it would put him in that vulnerable state again. And now they travel all over. He swims and he hardly had sickness, but if he does, he rebounds beautifully without kidney failure anymore. It's a beautiful thing. And mom and dad, now we see the whole family. And mom actually was trained by me in our training, because you start to become such a believer in, and she's a physical therapist. So she's, like me, has seen both worlds and sees the benefits of both. And obviously the benefit of biomagnetism.
You had a client too that was a success story that went on Katie Couric, didn't you?
Yes, yeah. If I knew that she was on Katie Couric before I saw her, I don't think I could get so neutral. I think I'd be a little afraid to treat her. Yeah, she outwardly speaks of it on social media, and so I'm very guarded with privacy and HIPAA. But her name is Kelly, and so I can freely say this. And she was paralyzed, wheelchair level. Anytime she went off her antibiotics, she came to me with 78 medications and supplements that she was on, either by docs or by herself, because people get desperate and they just take things on their own. And she had smaller children, and she came to me, and we were able to get her off of the majority of her medications and her supplements and chip away through biomagnetism at her and load, which she was told was strict Lyme disease. We found that strep was actually the number one thing that was causing her paralysis. So when she went off the antibiotics, the paralysis kicked in due to the strep. So once we cleared out that strep, she was down to, I think, like a biotin and like a vitamin D. And then she became an aerial yoga instructor and got her strength back. And she's one of our biggest fans. And she still comes to clinic for her maintenance, because we all get exposed to things, so we can come in and just clean the layer off, as opposed to having to start from the bottom again. But people don't go back to where they were.
Is this strep throat you're talking about?
Interesting question. It's not. That's where it's so confusing, because it's not strep. Sometimes it's strep throat, but a lot of times these strep infections, which are bacteria, are in the bloodstream, and they go deep into the bones and the muscles and the tissues. And that's why it's hard to check a rapid strep or to do any type of testing, because it can show negative. A lot of times, from our experience, I want to make that really clear, is it's the child that doesn't get the strep throat that's the carrier of it, and ends up having more disease process and more mental instability and more OCD type symptoms and sickness, because they carry it, where the other child in the family is the one who outwardly had the strep infection. So we see a lot of carriers in families. I would say we deal with a lot of seizure cases too. A lot of seizures could come from many different areas. A lot of them are adult onset seizures. It's almost like the nervous system is using it as a pressure cooker, like a default, to get rid of whatever's built up in the system. And we have also had a case where there was some significant traumas where a lot of these start. And then in turn, a lot of our clients will then manifest with mental health conditions. And they will even get, some of our patients from years ago, our clients, are institutionalized. And it ends up being that it's underlying infection load or emotional traumas or hormone imbalances, nervous system imbalances that put them in this place, right? And then none of the meds are really working properly. They're more Band-Aids. And one client ended up manifesting from these traumas and buildup of infection to having so many seizures, countless amounts, before she came to us. And with youth on people's side, it tends to help, because they don't have this body that's been plagued for so long. So they respond very quickly, usually. And I think it only took this client a couple sessions before the seizures completely went away. We worked on emotional trauma. We worked on Epstein-Barr virus, which Epstein-Barr virus I could treat. I tell people I can treat all day long on the side of the road and never run out of clients. We all carry it. Epstein-Barr virus turns into mono. And it's super, people get really, obviously very worked up around COVID, and there was so much attention, not a lot of attention around Epstein-Barr, and it transmits the same way through spit droplets or sharing water bottles, especially college kids, turns into mono. That plagues the body. This deep viral load plagues and can show up as sleep disturbance, anxiety, OCD, the list goes on, brain fog. So I think to back up on this client, we ended up doing those loads of infection and emotion, and seizure stopped, emotions stayed nice and stable, and she's getting her life back. So, and there had been countless neurologists, countless medications for years. So that's cool to see that people could be a lot medication free and symptom free after working in biomagnetism.
The CDC now also says that Epstein-Barr virus can be linked to MS, right?
Yeah, that was an interesting one because I have had some clients who were diagnosed with MS, multiple sclerosis, young people. And through the use of biomagnetism and digging, we found this perfect storm, and a lot of it being Epstein-Barr virus. So then working on the symptoms through biomagnetism that manifest to look like MS, all of a sudden lesions through imaging are gone. Symptoms are really diminished. And even our neurologists have contacted us like, what are you doing over there? And a lot of times you don't get that. These docs are overstressed. They are working so hard. They've got 40 people on their caseload in their defense. Like it's not easy. And they're interested and they're open to learning more. So we've had some really good contact and communication. And then the CDC released a couple of years ago that one of the main causes of MS is Epstein-Barr virus. So that was a lot of validity for us in a field of biomagnetism right now where we don't have a lot of studies. We don't have a lot of validity. This is newer. So over time, we're hoping to get a lot more concrete studies that are done to help support this science to then have more people buy in the Western world and become more of a conglomerate of Eastern and Western together. That's coming. We'll get to that. We just that's down the road for sure.
Yeah. So you saw success with someone who had full-on MS?
Oh, many people. We just had one that she was diagnosed, don't quote me, I think at 7 or 11, with full-blown MS, and she was in yesterday and has absolutely not one symptom, just got back from Europe, and she was abroad, and she had texted her mom, I'm living my best life. And it's pretty awesome to see. So it's mindset of these people. Biomagnetism's brilliant, and connecting and being heard. I think it's the perfect ingredients for success.
Why do you think people don't know about this? Does it have to do with conventional medicine?
I think people don't know about it, or it sounds newer just because it is newer. A lot of things happen West Coast first, and truly this was created in Mexico. So there are a good amount of practitioners in the California area, you'll see, and a lot of things move this way. My first training was done in Vermont and focused on Lyme disease, so you'll see more people in this area. But there aren't a lot of us that are pioneers in the industry. So I think over time, it's going to continue to grow. That's what we're hoping to do too, is bring a lot of awareness. It's all been word of mouth until now we have more of a platform with social media, and I think it's going to grow. Word of mouth is, in my opinion, is the best way, and our people advocate for us. So I think it's just not knowing. A lot of people just have, what is biomagnetism? I've never heard of that before. I still get that with new people in about 80% of cases, 90% of cases. So it's just new. And like anything, it's going to gain exposure with success. And we've got some really, really great practitioners at INDRA and beautiful practitioners in the area also.
It's just new to us, right?
Yeah.
It's not new technology.
It's not new technology. And quite frankly, this isn't new technology in general either, because even Einstein has said, the wave of the future is in energy medicine. Everything is about frequency. Everything is about energy. Everything has an electromagnetic field. This chair I'm in does. The energy between our conversations. Everything idle, matter holds vibration and frequency. So when we can tap into vibration, which is high power through magnets, the body vibrates. We're just aligning it. I show this really cool video during training when I train my clients, my practitioners, where the person takes a handful of rice and throws it on a table and then takes a bow of a violin and runs a certain hertz frequency or tune on the edge of the table. And all of a sudden, the pieces of rice vibrate into a perfect mandala, like a flower form. And then he moves it, strikes a different frequency. It changes and does a whole nother beautiful pattern. So how I represent that is our bodies when you're in dis-ease or imbalance. And that could be no symptoms. That could be, I'm just not feeling myself. That's enough to say something isn't right. So what we're basically doing with the use of magnets on the body, we give it the time to make those particles align properly to cause homeostasis. And in turn, you get this beautiful line up in the body that causes health. So that to me, quite frankly, talk about a 1-minute description. That's the best thing to do. We're taking a simple device from the earth, which are magnets from our earth. Our bodies are made up of particles from the earth, water and electromagnetic fields and particles. And we are putting them on the body intentionally in patterns to create beauty and homeostasis. And when everything is in order and perfect alignment, the body heals itself. That's as simple as it gets. Yeah. In such a complex manner, that's as simple as it gets. And that's all that matters. That's really all that matters.
Yeah, it's also like, electromagnetic, chemical, interactive relationship.
It is. There's hydrogen, there's ions. And quite frankly, I say it to I've had 100 students so far in my trainings. I preface by saying I am not an expert in science. You'll even see this today. I'm not going to focus on the science behind it. There are great books about it. Hydrogen, ions, electrons, pH, North Pole, South Pole. I didn't do that great in chemistry. Love science, not chemistry. This is chemistry. So when lined up perfectly, the body heals.
Look at MRIs.
MRIs, we actually love MRIs. People sometimes feel better with MRIs. MRIs are using high-powered magnets to image the body. A lot of our clients feel better after MRI and imaging. Look at, and also non-invasive lasers we're using now. That's all frequency. Everything is frequency. So we are just utilizing it in a different way to heal. It's super cool in my opinion. And it's basic. We spend a lot of time with our clients educating them. They'll be with me for some intense cases, 2 hours in clinic for even a simple case that will come in. They just want to work on their prevention. Hour and 15 minutes, we educate our people because we want them walking out going, I think I can say what this is about and describe it a bit and then say how it made me feel. So we have this pretty cool website, whymagnets.com, that was created because even with all of our education that we do for our clients, they walk away and their family's really eager to ask them, tell me all about it. And they can describe it, but they still feel like they can't represent it the way that they know they feel and what we did in the session together. So we created whymagnets.com, which is a 5-day e-course that allows the person reading it to digest information about biomagnetism in a really easy way to understand. And it's been super helpful for our clients to pass on to family members, say, I may not be able to describe it so well, but check this out. So it's bringing awareness to comparisons and contrasts and a likeness of other modalities in the holistic world, how we work complementary together, the science behind it, how to access. So that's been a great thing for us.
It's free, right?
It's free. Yeah, it's free. Whymagnets.com. Put your email in and you'll get the introduction email as well as 5 days in a row we'll get the e-course. Easy to understand.
you discovered or we found that ticks, mosquitoes, spiders, we all transmit Lyme and those other pathogens. It could even be functioning at 2% in the body, but it's still there.
Yeah.
Is it just Lyme?
Yeah, it's such a tricky area, and my expertise started in Lyme disease, and I don't even like to just say Lyme disease because truly Lyme disease is Borrelia. It's one area of the infectious protocol of the umbrella. We call it more vector-borne illness because what we know is 98% of my clients who have chronic Lyme disease and co-infections, because the co-infections are the biggest part of it all, have never found a tick on them, ever. So we know through our studies and through our experience through muscle testing that it also can come from spiders, fleas, mosquitoes, different types of insects. And it's those that add up in that cup, the cup analogy, over time. Maybe it took someone 6 bites, maybe more, before they started to manifest into a symptom of joint pain, digestive issues, brain fog, you name it. So we're known for it, and it tends to vibrate on the lower side. And when we talk about vibration, we talk about emotional vibration scale at INDRA, and the emotions and the heaviness around Lyme disease are a real thing. It is. A lot of my clients would say, I sometimes wish that it was a diagnosis of cancer because people would pay attention and you would visibly see it. And that's not to discredit cancer or minimize it. Lyme disease is massive and vector-borne illness is massive. And it's almost like a silent epidemic that we have. And we're able to chip away at those layers to bring people relief. And it's also an unlearning process because people will be like, my Lyme disease, my this. So we work very hard at language around emotion and say, maybe it's just, I have symptoms of, and it's not the attachment to who they are, because a lot of times they're clinging to it because that's all they have. It's such a desperation. So we work a lot on empowerment at INDRA, especially in the clinic. It's got this beautiful vibe where I'll deal with the deeper layers of Lyme in my private office because that's my original training. And then they get so much foundational work done in clinic to work on the nervous system, other infections, hormones, emotions, trauma, the brain. And it's got this beautiful, supportive, healing, positive vibe. So you'll see people walking out with their heads a little higher and feeling supported. And because Lyme itself, Lyme and vector-borne illness, co-infections are a real thing. And we've seen it come close to destroying a lot of lives, all ages. So
We live in a very sick society and, there's so much wrong with, diet, sleep patterns, all of it plays a part.
Yeah.
With the Lyme itself, do you think there's a cure for Lyme disease?
So we don't, it's a very great question. We don't use the word cure because the proof, right? Even the blood work, the testing of it's so inconclusive. Because a lot of times someone could test positive, negative for co-infections of Lyme disease or vector-borne illness, but they feel debilitated. They come to us, we muscle test and find you're loaded. And then by the time we work on the body, and then someone might be curious and go back and do testing and then they flag positive. Well, that happens because the antibodies are now showing. They're out of the depth and they're in the blood now as showing as die-off. And some doctors I've worked with have said they don't even do much testing afterwards to show proof because number one, it could be inaccurate, but number two, antibodies can stay in the blood for up to 20 years. So they've pretty much go, let's make this symptom-based. If you feel better, that's all that matters. That's the number one thing is feeling better. Okay.
Why do you think the testing is inaccurate initially when they
my theory is that when it's been in the body for a long time, a lot of these pathogens, infections are really smart, especially some of these bloodborne parasitic ones. They dig deep into the body so they can hide. They're opportunistic. They go, oh, good. There's a concussion up there. Oh, there's a pacemaker now that most likely the heart went in the first place due to Lyme disease. I've got little niches, the bowels. Oh, there's places I can hide in there. They want to stay in a cozy environment. They don't want to be found. So I think it digs deep, my personal opinion, it digs deep into the body. And that's why the testing could be really difficult. Yeah, but I mean, people need to start somewhere. If they don't find us, they have to go somewhere. So sometimes the testing is helpful sometimes. It's just not as accurate as we would hope. As far as a vector-borne illness or Lyme disease, I believe the CDC says it's got to be about 48 hours of the tick being on the body for it to transmit infection. And what we have found through our muscle testing and through symptoms is that it can take literally 15 seconds. For once the skin is broken, things could start to dump. So that's a whole different arena than we're used to, and we see a lot of that at our clinic and at our space. And there is an infection called rickettsia. And rickettsia is a blood-borne infection that we are now finding that studies show that 85% of people upon autopsy from Alzheimer's or late onset dementia have rickettsia in their bodies. So we wonder, was there mosquito bites? Was there some type of other vector-borne infection put into the body, dumped in, and then transmitted this infection rickettsia that then affected the brain? And now we look at it as Alzheimer's, one of the causes of Alzheimer's and dementia. So we do find that a lot when we're scanning our clients, and we have found in many cases that we are able to start to reverse symptoms or halt or at least maintain the baseline of where they're at if they're progressive with Alzheimer's and dementia. So we have a lot to learn still. We're in an arena where there's so much more growth, and that's why even through INDRA, my protocol, our protocol, it's a living, breathing protocol. It will continue to grow. There's COVID protocols, Lyme protocols, because if we stop in science where we are, we're not going to make progress. We're ever evolving.
Were you seeing people not get as bad, like better as what, like that?
I think it's because I just have such a love for emotion and having deep conversation. I think that's where this started. And I was finding that with my clients, that's what we were doing. We were having it wasn't just about the symptoms they were having, but what it was doing to them and their family. And that's where I said, okay, there's these wonderful protocols out there that deal with infection and deal with certain other conditions. But I felt like more emphasis needed to be placed on emotion, on trauma, on the nervous system, the parasympathetic, the sympathetic nervous system, on hormones, on the brain. I really, and it's my love area. So I said, wow, what if I come up with, it just started with emotion. It was starting off as this simple scale from joy and peace at the top down to guilt and shame at the bottom of the vibration scale. And I found that when we were able to put these pairs on someone sometimes in isolation, but along with some of these pathogens or other imbalances, the speed of recovery or the change in emotion was so monumental that I knew I was onto something. And then from there, I thought it was this little adjunct to other great protocols, and now it's grown into a standalone. INDRA Biomagnetism protocol stands alone because it's able to look at the emotion, the hormones, the nervous system, and the most common pathogens that we end up working with, as well as brain trauma, concussion protocol, and a lot of work around PANDAS, which is a pediatric condition where strep affects the body and the mind. And you'll see tics that will come, motor tics, as well as a lot of mental health conditions, which a lot of times get misdiagnosed as just being, not just because it's heavy, but mental health abnormalities. And it ends up being the root is in strep. So that's been a journey to create also. So it's a living, breathing protocol is what we call it. And one of my teachers had said, Joan Randall said to me, who taught me the Lyme protocol, said in one of my first meetings with her, and I'll never forget it, when you place a magnet on someone, that first magnet, you are pushing on every emotion, physical condition, memory, trauma, emotion that they've ever had in their entire lives. So that first session is so impactful, and we take it very seriously at our facility. All right, so we're going to break it down of, okay, now you've got some history. Is how do you access this? How do you find us? How does the process work? So we are very fortunate to have the setup that we have now, because prior I was more of a one-man show, and thanks to Caroline, my wonderful assistant, and many more titles that she carries, we've worked together. But it was still, we were limited. We had years wait list because we can only see one person at a time, and it's hard to make people wait on a wait list who are very sick and not well. And desperate. So we had the idea of opening up a clinic. So where before people would just access me individually, now we have opened up in Southern Nashville, right over the border, an open clinic style. And what this looks like is beautiful open setting. There's 4 recliner chairs. Actually, they look a little like this, and they recline full. There's a partition barrier, so there's some privacy. It's almost like a private pod. And there's 4 of them looking out to the trees and the outside with big open windows. And we're able to see about 20 to 30 people a day, a couple days a week, Tuesdays and Thursdays in the clinic. And what does that mean? So say a person is either feeling their best and they just want to maintain their health that they already have, which is like our ideal client. And then we have people that are very, very ill and they don't even know where to get started. So they would go onto our website and they would thoroughly read. If it's somebody that has a lot of chronic Lyme disease or really chronic autoimmune conditions, they're not quite sure, they would fill out an intake. And the intake's comprehensive. And then we kind of decide, do they start off in the private room with me doing thorough scan because there's just more material as far as Lyme disease and other areas that we have talked about earlier, and autoimmune disease? Or do they just go ahead and jump right into clinic evaluation? And I would say 90% of people would qualify for that perfectly because we cover so much territory in the INDRA protocol. As I had said, it covers most common pathogens, which are infections, hormones, nervous system, emotions, brain trauma, you name it. So the ease is you click on clinic evaluation and you book it yourself. So it's an hour and 15 minutes, comprehensive intake. You learn about biomagnetism, so you're an informed consumer. And then from there, you'd move to the chair. That would be done in a private room. And then you move to the chair and you have your space. And it's communal, meaning you see people coming and going and you hear it, but it's very peaceful and respectful and has a private nature to it. It's just an easier way to get in quicker. It's a little more affordable, so a lot of people can access it much easier. So once the evaluation is done, we get that master list of what's going on with the person through that muscle testing, where we will use the pendulum, as we talked about, to be able to access what's going on through our yes and through our no, depending on what we find in the body. We make a nice list, and then we chip away at that visit after visit. And at each visit, you can assume that maybe we're working on some infection, maybe we're working on some concussion work, maybe we're working on some emotion all together at the same time, because the person's comprehensive. We're looking at them as a whole person. And they come back within 2 weeks-ish, week and a half, depending on what the body says. We always do what the body says. And then they rebook and come back again. We also have some great packages going on now for our students because we have so many college kids that are thriving with biomagnetism, and they do it at school with us through something we'll talk about that's a remote treatment. We also do remote treatment in clinic where the person doesn't have to be right there, but we reserve the chair for them. And we'll talk a little bit about remote work, meaning they could be in other parts of the world and still receive the same treatment, even though their physical body isn't right there. And it is as effective as if they are right there with us. So when they get to the end of their list in about a couple weeks, a couple months maybe. It depends on the severity of what's going on. Then they go into what we call a maintenance mode, and they might want to come back once a month to just skim that cup analogy, to get things out of the cup, keep things really low so their symptoms don't keep resurfacing. And also life happens, someone might get COVID, they get a cold, they have an emotional trauma. They can come in and we can work on those things together to keep them in their best health. So it's got a really cool vibe. It's beautiful music is playing. We have noise canceling headphones and blankets so people could really go inward, sometimes eye masks. We have families that come. So sometimes we'll take the partitions down and we'll have a family of 4 right there all together from newborn all the way up to the moms or grandparents. And it's just got a very peaceful, loving vibe with a lot of care-centric. And we have 2 practitioners at a time running the clinic for the day. And that can alternate depending on what day it is. And I'm always popping out too and meeting people. And it becomes like family is basically what we've created there, which is pretty special.
And so remote.
Yeah, let's talk about remote work. This is where it can get a little woo-woo, and we've tried to pull you in and bring it into more of a logical, scientific model. But what I know for sure about remote work is it is truly almost as scientific as it gets, because we're dealing with energy fields and quantum physics. And I'll let you guys kind of go off on that, research yourself, but quantum physics are a real thing. We are not just in this one dimension. So what does that mean? That means that your physical body doesn't need to be right here with me for me to be able to read your energy, or one of my practitioners. So I'll give you an example. So I got a call from my nephew, and he had said, I'm struggling because I'm out of the country and I am having severe bowel and GI issues. Something I ate or something didn't go right. So I was able to muscle test him through the use of a pendulum. I know his energy, and I was able to go through my books and find out that he had a really good bacterial infection, a couple of them from some water he had drank. So I ended up taking the magnets, and I placed the magnets on my table as if he was right there with me, all right? The theory is, does he actually send a hologram of himself to be with me, or am I sending the energy? It doesn't matter. Energy is energy. As we talked about before, Wi-Fi, internet, prayer, we don't really know how it works, but time and space, it travels in a millisecond. So I placed for him. He was in Colombia, so they didn't need to stay on as long, because as we talked about, they stay on as long as we can neutralize the electromagnetic field, the pull of gravity towards the equator. And within 20 minutes-ish, his symptoms started to slow down, and he slept through the night without any more symptoms. So some people might say, is it placebo? It doesn't matter, because we've even seen testing done afterwards with people with remote work where there's been beautiful symptom changes and results to prove. So when someone comes for clinic, they sign up at the bottom. Is it a remote visit or is it in person? And if it's remote, we end up calling them or doing a telehealth type check-in, and we scan them. Everything in clinic is done with that pendulum, and we tell them what we find, and we end up placing we tape the magnets right to the chair and let them process. And that person on the other end might be relaxing themselves, or they might be going on with their day. It doesn't matter. And after the session is over, they will continue to process for that week and a half, 2 weeks, and then we go about the next layer. So I would say at this current moment, about a third of my practice is remote, which is a huge amount all over the world. And it makes biomagnetism much more accessible to someone who might feel like they can't quite get to Nashua because of distance, or also because they've got a condition they can't even get in the car for 30 minutes. So it's pretty profound.
Is there anyone who biomagnetism is not for?
Yeah, it's so interesting because it sounds so broad, but biomagnetism truly, because it works on the person, the human, and not the condition, that I haven't met someone that it wouldn't work for, but they have to believe in the body's ability to heal, or just I've had maybe one person that was so resistant was brought by a parent and forced. The child had been through so many doctor's appointments. He was done, and we didn't go further with him because he was just so closed off and so guarded and scared because he had been in the medical community for so long and was tired of it. But other than that, it's for everyone. There are some contraindications we do look at, but if you are an excellent muscle tester, which I call myself and my team, we're excellent muscle testers, you can work around it. So like an example would be a pacemaker. If someone has a pacemaker, we don't put the magnets directly on the pacemaker because it can drain the battery. So in turn, we would find an alternate spot which would have the same energetic effect on what we're working on. We work on pregnant women. Sometimes people would say that would be a contraindication from original biomagnetism, but we've had a lot of success with working with pregnant women, and the babies get the effect also, and then the babies come to us right afterward. The third one in classic biomagnetism would be chemotherapy. Again, I tell my students, my practitioners, you stay within your safe zone and what you're comfortable and accurate with testing. You have to be very clear with that. And I know that I'm good at it, so I will work with people with chemotherapy. The reason being is it could be very toxic, and with the magnets pushing around the toxicity, sometimes we can have an issue. But in my 10 years, I've never had an issue. And if not, some people I've even had them be able to keep their hair. They haven't had hair loss. The chemo rashes have not developed. So I stay humble enough, and my read is good enough, as well as my team, to know we stay in our lane and we don't ever push the body more than it says to be pushed. So we realize that insurance doesn't recognize biomagnetism, so it is not covered under insurance. In turn, it's a cash. It's people would pay out of pocket for it. So we have opened up the clinic to make it as affordable as possible for people to access. And we also have programs where bigger families come. We have maybe one of the children gets their treatment for free, and different packages and things that we offer to try and help the community as much as possible. And again, more of this is described. Whymagnets.com is a great tool to use to be able to educate yourself if you're on the fence or confused or interested but not sure, or you're all in but still don't know how to describe it to a person in your life. That's a great tool to use to be able to share the information, to empower all of us to learn more about this. Because I know I'm biased, but this modality is so powerful. I'm humbled every time that I work with a client, and I get as excited as they do. And Caroline and I together, when we're in the room, it's like we're buckle up. Like, here we go. We're in this together. We are as invested as you are in your health, and it makes a difference. So it just can be tough to describe and understand until you're in it.